Barness here. I'm a board-certified psychiatrist. Today I want to talk about DBT. I get real excited thinking about dialectical behavioral therapy. It's a type of therapy that involves skills-based learning. It's not really psychobabble. It's a type of learning that involves here and now problems and solution-oriented approaches. Its strength is kind of its weakness. It's one of the things that I like to say about DBT in the sense that what it doesn't do is go backwards. Okay, it doesn't really go into the past as much. It doesn't do what we call processing, which other therapies tend to do often. And concepts like mindfulness and radical acceptance and wise mind and similar things help folks with emotional regulation and a lot of similar topics. I call DBT kind of the diabetic diet of therapy. And what I mean by that is, if you think of a diabetic diet, right? Like, what is it? It's a low glycemic index, a high protein diet, right? And that's really good for anybody. So even though it's been tagged with diabetes, really it's good for anybody. So I would say DBT is the same thing. It's been tagged with things like borderline personality disorder or trauma, eating disorders, self-harm. But I would say it doesn't matter if you have depression, anxiety, or anything in between, DBT is good for you. Hit me up with your thoughts.